Hmm, something's missing. Hi everyone, long time no see. Today is the 11th of December, so it's just 12 days short of a 6 month post surgery. And as you can see, my braces are off. So yay! My braces have been off since 2 days ago, Friday, and because the surgeon at my orthodontist decided that to just remove it. Actually, it was scheduled for 28th of December, but because of some scheduling issues, they wanted to move to January, which I was like, what? It's going to drag until the new year. But my orthodontist said that actually I'm good enough to remove it early, so she removed it 1 week early. Next week I'm getting my retainers, but my lower jaw is really on a fixed retainer. Okay, I keep wanting to say permanent retainer because apparently I have to wear it for 5 years, which is, oh gosh, right? And I'll be having other retainers, a transparent one for both. But bottom I just need to wear when I sleep. The top I wear on a daily basis, just to take it off when I eat because there's a gap here that I need to keep with a spacer so that I can actually go for the implant. I will be meeting my surgeon in February for the 6 month, 7 month, 6 month post surgery checkup. Okay, and yeah, it's slightly more than 6 months actually. So and subsequently in March, I'm going to see the surgeon for again for the crown doctor for the implant, so that she can measure the alignment and how that I can have the implant. So as you can see, I'm pretty happy with the alignment now. The center line is perfectly aligned. It didn't happen right away because right after the surgery, there was a period of time where it was a little bit to the lower jaw was a little bit to the left. So there was a period of time that I had to wear the rubber band hook that's from the center to here. So it was like as I speak, there's this white color thing in right smack in the middle. There were periods where I look like a vampire with two boxes, then it shows a little bit of white here like a fang. But with this, can you imagine how ridiculous it was? And I work in a job that I need to talk a lot, so I'm really thankful for my clients and my friends who actually during the period of time look at me, and that was totally weird. And okay, so I still feel a little bit imbalanced. My left is a little bit more open than my right, and the orthodontist said that it's fine because over a period of time, through chewing and everything, you will go back. I don't know how it works, but let's just take her word for it. Okay, next thing is that after cleaning, if you notice, this is like a Grand Canyon size of gap there. It's quite scary. I thought it was a very bad gum recession. If I you remember, I actually mentioned in the previous video that I suspect there was a little bit of gum recession receiving during the process. But after cleaning, the orthodontist mentioned that it's probably because the tartar was actually cleaned off and the gap also become more obvious, and also because my teeth is naturally more triangular. So you just imagine this is my teeth, this is the bottom of my teeth. So because the lower teeth was more crowded in the past, it was like this. So the gap which is here, okay, was not that obvious. Okay, it was crowding like this. So now not only it was pushed open like that, and the tartar that was initially here got cleaned off, and this gap looks very obvious. And the sad thing is that there's no way to actually recover your gum. So I probably going to actually, I understand that vitamin C protein will help with the gum recovery, so and green tea. So I will try all these non-conventional methods to see what I can do to, I'm a little bit conscious about it. But overall, it looks good. Okay, this one, as you can see, the discoloration is because of the root canal procedure that I've done almost 7 years ago. That 7 or 8 years ago. So over this period of time, there's no blood supply, so it then naturally gets decolored. I need to either bleach it or I have to put a crown over it. Either way, it will be different color. So take care of your teeth. Do not put yourself through root canal. It's painful, and it's just this. Okay. Now, next thing is that my sensation on my face. Are they getting back? Well, I can slowly feel the bottom. Now the inside, as I do this, I can feel it's a little bit of sensation coming back. How do I know? It's because it feels like we just had injection for the local anesthesia, and it's slowly waking up. That feeling, like, or it's in effect, where you do this, you feel like it's swollen there. So it's just because you're not fully activating the muscle, so you just feel like a piece of dead meat there. But if I don't consciously do this, it wouldn't affect me. Second thing is my jaw. The sensations are slowly coming back because, like, these teeth and some teeth along the way, they are just very sensitive in the sense that a slight pressure will make it feel very sore. So I reckon that is the sign that it's actually recovering. Next thing I'm a bit concerned is that my chin looks a bit not balanced. This side is lower than this side, and when I yawn or open it big, I can feel a little bit of pain here. Okay, still, this is not new. I think I've mentioned in previous video. So in February, when I see the surgeon again, I will see. It's very funny, the day on Friday when I just take off my braces, and I actually consulted the orthodontist regarding this. And as I was walking out, I saw my surgeon going to look for my orthodontist. Presumably, it's another patient that's going through the same process as I was, and he couldn't recognize me. I was seeing him. I was like, "Hey, Doctor Song, Doctor Song," and he was like, "Oh, hi, how are you? How do you feel? And then I was just telling him about this. He had a chat with me. Then we went back into the room to talk to my orthodontist, and so he said that I should go for a gum specialist if, let's say, after a few days he doesn't recover. So it's quite interesting. He's a very nice guy, and I think I'm almost out of the water now. I presumably I can eat anything I want now, but I'm still going pretty easy on peanuts and all these things. I still try to go for something that's less chewy, just so that I don't exert too much force on it, because also there's a little bit of soreness here and there. So I just want to, like, some beef stew, cheese. I can eat salad now, no problem. Broiled chicken, breast meat, all this no problem to me as well. So I guess the worst part is over. The permanent the fixed retainer is really, I know I have to get used to it because I keep licking on it. It's just something there, but I'm quite happy with the result. Okay, I'm pronouncing a lot better. I can't wait for this whole thing to be done. I can't wait for everything to recover, and I think I'm definitely smiling more. I'm still getting used to this new feel, new teeth. After taking out the braces, it's still a little bit of getting used to as well. It's just feel a bit naked once it's off, but I'm fortunate that I only wore it for a year, slightly over a year. I have a friend who wore it for, I think, 2 years or 3 years, and she's about to take off braces at the same time as me, and she was crying to me about attachment issues with her braces. I was like, what? I never even know there's such a thing. I'm so glad that it's off. I didn't take a picture of it. So thanks so much everyone for following me all this time. Some of you has reached out to me, some of you have actually messaged me in private. I know some of you are actually going through this right now or about to go through it. I wish you all the best. Some of you asked me for last advice, supplements and everything. What I can only recommend is things that's worked for me. And I would just say, I'm really glad that you are there. We share this experience together, and we're about to share this experience together. Or if you're watching this in the future, we will be sharing this experience. And I think it's great that I'm sure when you look back in the future, you'll find this journey really a great experience, because not many are blessed to having to go through this really a life-changing experience. And you're going to learn a new mouth, you're going to actually greet a new face, you're going to actually face new life, and be a lot confident, be a lot comfortable with yourself in front of people, and smile a lot more, and really just start living. So I really look forward to hearing from you guys. If you leave a comment below, just let me know how, in what way I can actually help you guys. If you can, maybe get in touch with me, show me your before and after photo. I'll be really glad to actually see. We could probably, if you're in Singapore, we could probably also maybe have a little group where we can exchange our experiences and form a support group for each other. I have a little cousin. He's about 1 year old, and one slightly over a year old, and we are starting to notice that he also has the same issue. And I was just remember saying that if ever he's going through this process, I want to be there with him, just so that he feel that he's not alone. He knows that I'm there. I've been through it. These too shall pass. So thank you so much, and I probably will do another update after the checkup, and subsequently the 1 year checkup, the 2 year checkup. That's where it completely healed. And thank you everyone, and see you.